6 forms. None of them have ever arrived in your mailbox. Each one releases money that federal law already says belongs to you. The Social Security Administration has your name, it has your work record, it has your spouse's work record, it has your late spouse's work record, and it is holding money in each of those categories right now this month because no one has submitted the correct form. The agency will not call. It will not send a reminder. It will not flag your account when you are receiving $800 less per month than the law entitles you to. It processes what you file. Everything else sits. Here are the 6 numbers I need you to hold right now. 3.1 million Americans received an average of $360 more per month starting in 2025. Most of them had to ask for it. Some still have not. A widow who was receiving $1,040 per month. The law said she was entitled to $2,610. She received the wrong amount for 3 years. $47,000 gone. Not recoverable. A senior whose income is $1,400 per month. Her state has been legally authorized to pay her $202.90 Medicare premium every single month. She has been paying it herself for years. 1 form each, none mailed, none explained, none automatic. Stay with me through the end of this video. The final section contains the shortest window and the largest amount of money permanently at stake. Do not skip to it. The math in the middle is why the final number matters. 6 forms. Let's start with the one tied to a law that changed, and that 3 million Americans still haven't fully collected on. In January 2025, a law went into effect that directly increased Social Security benefits for over 3 million Americans. It's called the Social Security Fairness Act. It was signed on January 5, 2025, and it did something that had never happened before in the history of the program. It repealed 2 provisions that had been reducing Social Security benefits for public employees since 1977 and 1983. Here's what those provisions did. If you worked in a government job that didn't pay into Social Security, as a teacher, a firefighter, a police officer, a federal employee under the Civil Service Retirement System, 2 rules in federal law reduced your Social Security benefit. In some cases, they eliminated it entirely. The windfall elimination provision passed in 1983. The government pension offset passed in 1977. Together, they told millions of public servants, because you have a government pension, your Social Security is reduced or gone. For decades, retired teachers watched their Social Security checks arrive smaller than the law would have provided anyone else with identical earnings. Widows of firefighters received survivor benefits cut by 2/3 because their husbands had a pension. Federal employees who paid into Social Security through second jobs saw that contribution return almost nothing. The Social Security Fairness Act repealed both provisions permanently, retroactive to January 2024. The Social Security Administration has sent over 3.1 million retroactive payments totaling $17 billion. The average monthly benefit increase is $360. Some beneficiaries received over $1,000 more per month. Here's where this gets urgent for you. Most affected beneficiaries received their adjustment, but not all did. And there's a category of people this law affects who may never have filed for Social Security at all, because they assumed the old rules would reduce their benefit to near zero. It wasn't worth applying. Now it is. Do this right now. Open ssa.gov/myaccount on your phone. Log in. Under Benefits and Payments, find your current monthly benefit amount. Write it down. Then call the Social Security Administration at 1-800-772-1213. Say exactly this. I am calling to confirm whether my benefit was recalculated under the Social Security Fairness Act, and whether I am owed any retroactive payment going back to January 2024. Write down the name of the representative and the date. If you're a surviving spouse of a public employee, if your late husband or wife had a government pension, the repeal of the government pension offset also affects your survivor benefit. I'm about to spend significant time on survivor benefits. Hold that connection in your mind as I explain what that benefit is and what it costs when the wrong form is filed. When a spouse dies, Social Security does not switch you to the higher benefit. It does not send a letter explaining that you have a choice. It does not calculate both amounts and ask which one you prefer. It continues paying exactly what you filed for, your own retirement benefit, and holds everything else until you submit a separate form. The form is SSA 10, Application for Widows or Widowers Insurance Benefits. Under federal law, a surviving spouse is entitled to up to 100% of the deceased spouse's Social Security benefit. 100%. Not reduced, not split, the full amount your late spouse would have received. That entitlement requires a separate written application. Filing your own retirement benefit does not trigger it. Your spouse's death does not trigger it. A phone call to report the death does not trigger it. Only SSA 10 triggers it. Let me show you what this costs when SSA 10 is never filed. A woman, I'll call her Margaret, is 69 years old. A retired school librarian from Knoxville, Tennessee. She filed for her own Social Security at 64. Her benefit, $1,040 per month. Her husband passed away in 2022 after 41 years of marriage. His Social Security benefit at the time of his death, $2,610 per month. When he passed, Margaret called Social Security to report the death. The call lasted approximately 6 minutes. The representative confirmed the death, canceled his payments, and issued a one-time $255 lump sum death benefit. At no point during that call or any call after it did the representative tell Margaret she could file SSA 10 and receive her husband's $2,610 benefit instead of her own $1,040. The difference, $1,570 every single month. Margaret continued receiving $1,040 for 2.5 years. By the time a benefits counselor caught the gap, $47,100 had permanently disappeared. Not recoverable, not appealable, gone. Here's the law that makes this irreversible. The retroactive window for survivor benefits is capped at 6 months. Every month that passes without an SSA 10 on file is a month of survivor benefit that cannot be reclaimed. No exception. No senior Social Security official can override it. No appeal process restores a missed month. 6 months, that's the entire window. Now, I want you to understand something about that 6-month rule. This cap has been sitting in federal law for decades. It was written into the program at a time when the typical widow remarried within a few years of her husband's death. The cap made sense in that context. The survivor benefit was conceived as short-term bridging income, not long-term support. That assumption hasn't been true for generations. The average American widow today is 59 years old when her husband dies. She'll live, on average, more than 20 additional years. The 6-month retroactive window has never been updated to reflect that reality. Congress has never extended it. The Social Security Administration has never been required to proactively notify widows that SSA 10 even exists. The rule is decades old. The financial consequence is being paid by Margaret right now. Let me show you the math in full. Margaret's monthly shortfall, $1,570. Over 20 years of retirement, the average for a woman her age, that gap compounds into $376,800 in lifetime income. Income that was already authorized. Income that existed in the federal benefit system under her late husband's Social Security number. Income that required one form and 30 minutes. The form is free. The application takes 30 minutes. The money is authorized by federal law. The 6-month clock is running right now. Here's what I want you to do immediately. If you're widowed and currently collecting Social Security, pull out your benefit statement or open ssa.gov/myaccount and look at your benefit category. If it says retirement insurance benefit, and your late spouse had a higher Social Security amount than yours, you may be in Margaret's exact position. Call 1-800-772-1213. Say this: I am widowed and I want a written comparison of my current retirement benefit and the survivor benefit I would qualify for under my late spouse's record. I also want to inquire about filing Form SSA 10. Do not ask a general question. Ask for the written comparison. Ask the representative to calculate both numbers while you're on the phone. Write down the name and the date. If your late spouse had a higher Social Security benefit than yours, and for most married couples where one spouse worked longer or at higher wages, they did, SSA 10 is the form that captures that difference for the rest of your life. Quick reminder before we move on. None of these forms cost anything to file, and none require a lawyer. The paperwork itself is simple. The only real barrier is knowing it exists. The survivor benefit applies after a spouse has died. The spousal benefit applies while both of you are alive. Under federal law, a spouse is entitled to up to 50% of the higher earning spouse's primary insurance amount, the benefit they receive at their full retirement age. This applies regardless of your own work history, decades as a caregiver, years of part-time work, a career at lower wages. The spousal benefit exists completely independent of what you personally earned. The form is SSI-2, Application for Spouses Insurance Benefits. Here's what I need you to understand about how the Social Security Administration's online system is designed. When you go to ssa.gov and file for retirement benefits, the system presents you with an application based on your own earnings record. It asks for your information, calculates your benefit, processes your application, and it does not surface SSA-2. It does not ask whether you're married. It does not calculate what 50% of your spouse's benefit would be. It processes the retirement application you submitted and stops there. This is not a glitch. It is the structure of the system. Seniors who enroll online, which the Social Security Administration actively encourages, receive a benefit based solely on their own record. SSI-2 is a separate form requiring a separate filing. If you filed online and received a retirement benefit, there's a meaningful chance SSI-2 was never filed and the spousal calculation was never run. Here's the situation where this costs the most. A woman spent 18 years as a home health aide, then 12 years as a part-time bookkeeper. Her own Social Security benefit at full retirement age, $890 per month. Her husband spent 39 years as a civil engineer. His primary insurance amount, $3,200 per month. 50% of $3,200 is $1,600. Her spousal benefit under SSA-2, $1,600 per month. She's been receiving $890. The difference is $710 every single month. She filed the retirement application the Social Security website guided her to complete. SSI-2 was never filed. No one mentioned it. The Social Security Administration processed exactly what she submitted. Now, here's what most people don't know about divorced spouses. If you were married for at least 10 years and are now divorced, you are still entitled to the spousal benefit on your ex-spouse record, as long as you're currently unmarried and your ex-spouse is at least 62. You don't need your ex-spouse's cooperation. You don't need their permission. The Social Security Administration will not notify them when you file. If your marriage of 10 or more years ended years ago, and your ex-spouse had significantly higher lifetime earnings, SSA-2 may entitle you to a benefit you've never applied for. The income history is in the system. The entitlement is in federal law. The form has never been mailed to you. Call 1-800-772-1213. Ask the Social Security Administration to calculate what you would receive under SSA-2 based on your current spouse's or ex-spouse record. Bring your spouse's Social Security number. If divorced, bring the date and state of your marriage. The calculation is free. If the spousal benefit exceeds your own, they can explain the transition. Every month, Medicare deducts $202.90 from your Social Security check before it reaches your bank account. Most seniors accept this as the cost of Medicare Part B. It arrives as a deduction. It has always been a deduction. It seems fixed. It is not fixed for everyone. If your monthly income falls below certain thresholds, your state is legally required to pay that premium for you. Not reduce it, pay it entirely. The programs that do this are called Medicare savings programs. They exist in every state. The majority of seniors who qualify have never applied. Before I give you the income limits, I want to show you the real value of these programs because the premium is only part of it. The Medicare savings programs have 3 tiers. The first tier, QMB, Qualified Medicare Beneficiary, doesn't just pay your premium. It eliminates every cost-sharing charge Medicare imposes. Every copay, every deductible, every coinsurance amount. Under QMB, providers are legally prohibited from billing you any cost-sharing. Not reduced, not discounted. Prohibited by federal law. Here's what that adds up to. Your Part B premium alone, $202.90 per month. 12 months, $2,434.80 per year. That's the number most people focus on. But a typical Medicare beneficiary also pays roughly $800 to $1,500 per year in copays, deductibles, and coinsurance across doctor visits, labs, and specialist appointments. If you're hospitalized even once, the Part A deductible is $1,736 per benefit period. QMB eliminates all of it. The real annual value of QMB for a senior with average healthcare utilization, $3,500 to $5,000 per year, not $2,400. The face value of the premium is the floor, not the ceiling. Now, here are the 2026 income limits. Qualified Medicare beneficiary. Monthly income limit $1,350 if you're single, $1,824 if you're married. What it covers: Part A premium, Part B premium, and every copay, deductible, and coinsurance charge. Providers cannot bill you anything. Specified low-income Medicare beneficiary. Monthly income limit $1,616 if you're single, $2,184 if you're married. What it covers: your $202.90 Part B premium every month. Qualifying individual. Monthly income limit $1,816 if you're single, $2,455 if you're married. What it covers: your Part B premium. Asset limits for all three: $9,950 if you're single, $14,910 if you're married. Your home doesn't count, your car doesn't count, certain burial funds don't count. Look at those income numbers carefully. A Social Security check of $1,100 per month, plus a small pension of $400, is $1,500 total. That's SLMB eligibility. Your state can pay your Medicare premium, and you're paying it yourself every single month. Here's the betrayal embedded in this system. When you enrolled in Medicare, the Social Security Administration did not screen you for Medicare savings programs. It was not required to. Medicare savings programs are administered by your state Medicaid office, an entirely separate agency with a separate application running a separate system. The federal enrollment process and the state benefit process do not connect automatically in a way that serves you. You must initiate both independently. Millions of seniors are enrolled in Medicare and paying $202.90 per month, while their state Medicaid office has a pending authorization to pay that amount for them. The authorization can't be used until the application is filed. The application has never been requested. There's one more thing about QMB that almost no one knows, including many doctors and pharmacies. If you're enrolled in QMB, Medicare providers cannot legally charge your copays. If your doctor has been sending you bills, those bills are not legal. If you've paid them, you're entitled to a refund. If you're charged a copay at any medical appointment and you're QMB enrolled, say this before you pay: I am enrolled in the Qualified Medicare Beneficiary Program. Federal law prohibits cost-sharing charges for QMB enrollees. Please verify my status before billing me. To apply, call 1-800-633-4227 and ask to be connected to your state's Medicare savings program. Tell them you want to be screened for QMB, SLMB, and QI. The application takes approximately 20 minutes. There's a federal program called Supplemental Security Income. It is completely separate from Social Security retirement benefits. It has its own application, its own income rules, and its own asset limits. A senior can receive both Social Security retirement and supplemental security income simultaneously. The form is SSA 8000. In 2026, the maximum federal benefit is $994 per month for an individual and $1,491 for a couple. Income limit: approximately $2,073 per month for an individual. Asset limit: $2,000 for an individual, $3,000 for a couple. Your home doesn't count. One vehicle doesn't count. When a senior applies for Social Security retirement benefits, the intake process does not include an automatic supplemental security income eligibility screening. The agent processes the retirement application. Supplemental security income is a separate program. The question is not raised unless you raise it. If your Social Security retirement benefit is low, under $900 to $1,000 per month, and your savings are limited, supplemental security income may be a second monthly payment you've been entitled to since the day you enrolled in retirement benefits. A payment that was never mentioned. A form that was never presented. Call 1-800-772-1213. Say this exactly. I would like to know if I qualify for supplemental security income, and I want to file Form SSA 8000. Supplemental security income pays from the month of application. There is no retroactive component at all. Every month you wait is a month of payment that cannot be recovered. The difference between filing this week and filing next month is $994. Not recoverable. Not appealable. This next section applies only to seniors who filed for Social Security in the last 12 months. If that describes you, this may be the most time-sensitive section in this entire video. Under federal regulations, you have the legal right to withdraw your Social Security application and refile at a later date, but only within 12 months of your original filing date. After that window closes, the option is permanently gone. No exception. No extension. The form is SSA 521. Request for withdrawal of application. For every month past your full retirement age that you delay claiming Social Security, up to age 70, your benefit increases by 8% per year. The difference between a benefit claimed at 62 versus one claimed at 70 can exceed 75% of your monthly amount. If you claimed at 62, you accepted a permanent 25 to 30% reduction for life. If your original filing date is within the last 12 months, and you're now having second thoughts about that timing, the SSA 521 window may still be open. You repay what you've received. Your benefit restarts at the higher rate. Every day you wait is a day that window narrows. Call 1-800-772-1213 this week and ask specifically, is Form SSA 521 still available for my account? And what is my deadline? If the window is still open, act before it closes. This is a one-time right. Once it expires, it does not return. Before the final recap, it's worth saying plainly, none of this requires you to be a legal or financial expert. Every single one of these 6 actions starts with the same thing, a phone call and a direct question. The Social Security Administration runs quietly. It processes what you file. It holds what you do not ask for. It does not alert you when you're receiving $1,570 less per month than federal law entitles you to. It does not send a form when your state is authorized to pay your Medicare premium. It does not flag your account when the 12-month withdrawal window is 3 weeks from closing. It runs and it waits. Here are the 6 actions. Execute them in order. 1. If you have a government pension, teacher, fire,